Cruciate ligament, or CCL tear in the dog, is the most common cause of hind limb lameness. Cruciate ligament injury is often seen as either a sudden, acute injury that can happen with a rapid turn, a step in a gopher hole, or a slip on the ice, or as a chronic, slowly worsening, intermittent lameness that starts with a partial ligament tear and progresses to a complete tear. This video will focus on cruciate ligament repair in medium and large dogs with the tibial plateau leveling osteotomy technique, commonly called the TPLO. Diagnosis can usually be made with history and physical exam. A history of a sudden onset, non-weight bearing hind limb lameness, along with a toe-touching stance, are consistent with cruciate ligament rupture. The cruciate ligament prevents the femur from sliding down this hill, but when the ligament is torn, that is exactly what happens. The femur repeatedly slides down the hill, causing pain, inflammation, lameness, and possible injury to the meniscus. The veterinarian is often able to confirm the diagnosis of cruciate tear with palpation of the knee and a test called the drawer test. In this test, the doctor tries to move the tibia in a drawer motion in relation to the femur. When the cruciate ligament is intact, there will be no drawer motion. With a cruciate tear, there will be a significant drawer motion. A positive drawer test confirms cruciate ligament tear. For best long-term function, medium and large breed dogs almost always benefit from surgical repair. Unlike other techniques that try to replace the ligament with artificial material like heavy nylon suture, the TPLO changes the physics and angulation inside the joint. The technique is based on the premise that the femur sits on the tibial plateau or weight-bearing surface of the tibia, which is at a natural angle of 20 to 30 degrees. Once under anesthesia, the patient is transported to radiology for preoperative planning x-rays. Lines are drawn to show the long axis of the tibia, the tibial plateau, and then the tibial plateau angle, or TPA. This is the information needed to determine the rotation necessary to achieve the desired post-op tibial plateau angle of 4 to 6 degrees. The patient is then prepped for surgery and transported to the surgical suite. The knee joint is approached from the inside of the leg. A small incision is made to assess the meniscus, that shock-absorbing pad between the femur and the tibia. Planning marks are made on the tibia, and the tibia is cut with a semicircular saw blade. Marks are made along the cut for the adjustment. The rotational adjustment is made and the two bone pieces are held in place with a bone pin. The bone plate is applied and screwed into place. The skin is closed in a routine manner. Post-op x-rays are taken to confirm good plate and screw position and to measure the post-operative tibial plateau angle. The knee is then iced and lasered and bandaged. Post-op care involves icing twice daily, oral pain medication, passive range of motion exercises, and laser therapy. After the 2-week recheck, we always recommend rehabilitation in the underwater treadmill, typically twice a week for 5 weeks. These patients do great after surgery. The TPLO is an excellent technique to repair the torn cruciate ligament in medium and large breed dogs and has become the worldwide technique of choice amongst veterinary surgeons. If your dog is suffering from CCL tear, call the Ballston Spa Veterinary Clinic and schedule a consultation with Dr. Andersen. For more information, visit us on the web